we think about how we really mainstream the, oh, here we go, thank you. The use of evidence in practice, I think for me, I think about that involving a bunch of different stakeholder groups, but for this particular talk, we're thinking about the role of policymakers in helping to really mainstream the use of evidence. So I want us to think about how we're selecting evidence that's a good fit with local context and how we're using data to optimize the use of evidence in practice. That's something I'm going to talk a bit about. How we're building the capacity of government agencies to support the use of evidence in practice. I work in a lot of initiatives that are really seeking to transition a lot of treatment as usual slots, whether that's in child welfare or children's mental health, to evidence-based models. And it's really important, I think, for public agencies to really locate themselves in that work, because many times there's an emphasis on the consultants and the service providers themselves. And so I've spent a lot of time working with public agencies to think about what their role is in supporting the use of evidence in practice, and how we're creating hospitable funding, policy, and regulatory environments so that evidence can be sustained over time. So I think what we've seen recently in the last decade is a pretty big uptake of evidence. What we see a lot less of is really the sustainment of evidence in practice over time, and that's because a lot of the initial supports that are available to move evidence into practice, whether that's funding or supports for researchers or program developers, those supports typically diminish over time, and many times local jurisdictions struggle to maintain high fidelity implementation of models after a few years, and something that I actually have a really strong interest in. So if we think about this idea of what does it really take to achieve socially significant outcomes, our center kind of puts this formula up quite often, so you might have seen it if you've seen any work from our center. This idea that we need effective interventions, effective implementation methods, and enabling context to really help us achieve those socially significant outcomes. But as I noted at the beginning, there are many different stakeholder groups that need to play a role in installing all the components of this formula. And I think many times what we see is a sense of role ambiguity. So whether that's at the onset or throughout implementation, many stakeholder groups still, I think, try and struggle to understand their specific roles and functions that are necessary to really ensure uptake of evidence and then sustaining that. So you can see here in the inner context, I named some of the kind of usual suspects, and in the outer context, really thinking about those social networks that need to be formed and other external stakeholder groups. And so today we'll be talking about the role of policymakers, but what's really important is thinking about their role vis-a-vis the role of service providers, researchers, intermediary organizations, because all of them are really what come together, and they play coordinated and differentiated roles in ensuring we build infrastructure for evidence and achieve those outcomes. So I'm going to make 3 points, so just to provide a little anticipatory guidance. This is the first point. When I think about what it means to really scale evidence and what the role of policymakers can be, I want to think about that first box in that formula, effective interventions. And so what is the role of policy in helping to ensure a good fit between evidence and context? So when we think about what falls in that box of effective interventions, it's not just the level of evidence, it's also how fully operationalized is that model or approach. So how replicable is it? We have a lot of squishy whats that we try and scale. And then also, what's the contextual fit? So the Office of the Assistant Secretary for Planning and Evaluation has recently released a series of briefs, and actually one of the presenters this morning, Karen Blitz, is a co-author on the brief around contextual fit. And they really identify that as a match between kind of strategy and intervention components with the values, needs, and skills and resources of those who implement and those who also experience the intervention. We can't forget about those experiencing the intervention. And so I think one of this morning or this afternoon, we've been talking about the evidence that exists out there. And we've made, I think, a really good push in terms of helping to catalog that evidence. So in the form of clearinghouses, the What Works Clearinghouse, other national registries, blueprints, I think have really brought us a long way. I will say that I think one of the unintentional byproducts of some of the registries is that we focused a lot on the models themselves and we've begun to de-emphasize a little bit the fit between the evidence and the local context. And I think if we really want to see those social impacts, we really need to help jurisdictions do a really good match between need and fit. So working across not just this country, but globally, our center, what we see is a lot of times leading with the models. You know, sometimes folks who kind of grocery shopping down the aisle, and the cereal boxes are kind of those shiny new objects. I mean, I'm well aware, and with evidence-based models, which ones are the popular ones today, and that's great, and we want to make sure we move that evidence into practice, but unfortunately we have a lot of jurisdictions that are not doing robust needs assessments. They're categorizing their populations rather than really understanding the needs of their populations. And so we need to really help jurisdictions understand, does the model fit the needs of their children and families? Does it fit with current efforts? Are there resources available for them to do this work? And so when we really think about that dynamic interplay between all of the characteristics of the system, the service delivery organization, and the clients, it really calls for us to do early and ongoing assessments. So we need to make sure there's a good enough fit at the beginning, and then we need to do continuous assessments to make sure we're optimizing that fit over time. And so one of the ways that we've seen policymakers and those who work in government agencies, and this morning I think Catherine and Karen's talk really emphasized some of this, is how is it that government can really ensure that fit and need are being as emphasized as much as the evidence-based models themselves. And through RFP processes and planning grants, thank you for all government agencies that fight for those planning grants when they're up against incredibly tight timelines. Because it's those planning grants that allow us to take the time to really match need to evidence, underscore that there's cultural relevance, that it reflects community values, that we have the resources and the leadership commitment to do that work. The Permanency Innovations Initiative to reduce children's time in long-term foster care that folks in the Children's Bureau talked about earlier, an incredibly good example of having all the sites that were awarded funds in their planning year to do a reassessment of need. So they all came in with ideas about what they might do, and many of the jurisdictions ended up switching what they were going to do after that first year because they received technical assistance around robust, comprehensive needs assessments. Many jurisdictions struggle on how to do needs assessments that are iterative and multi-method and multi-data source. And it's really those needs assessments that we need to be doing more often and not just running some characteristics from the administrative data. I'm going fast, I know, but I think I'm all right. You with me? You look good, you look good, everyone looks good. All right. So this middle box of effective implementation methods, this is for us, you know, how it is we do really good stage-based work, how it is we're building an infrastructure. You heard folks this afternoon talk about those drivers to effective implementation. I want to emphasize those in this second point that I'm making. So the first point really being about need and fit. The second point being, if we understand the infrastructure that it takes to implement evidence, so we know that we need to build competency of those we're asking to do a new way of work. So how we select, train, and coach our practitioners matters. We know that we need to create hospitable organizational and systems environments. So how we're using data on a regular basis, how we're aligning policy and practice through our administrative procedures, how we're developing the right collaborative partnerships at the systems level. If we know that these things are the things that matter and the science of implementation tells us that they matter, then we need to be funding them and measuring them. So if we're not measuring each of those components of the infrastructure, we're in fact saying that they don't matter, right? So as part of our policy making and the way that we fund, if we really think about how it is we develop a sustainable infrastructure, and we know that it's about developing and improving and sustaining competency, it's about changing organizational structures and processes, it's about aligning policy and practice, which is so critical. I can't tell you how many times jurisdictions bring in evidence-based models and the fidelity requirements to those models are misaligned with their state or local standards, whether that's mental health, juvenile justice, or child welfare. Case contact, supervision, all of those things don't add up. So New York City, by the way, right now has the largest global rollout of evidence in their preventive side in child welfare, and is doing that granular work around aligning policy and practice with 11 models in their system now. So I'm happy to talk about that after this. But again, we want to measure what matters. So if we think that infrastructure matters, and we know that it matters, we can really talk about how do we measure implementation milestones and benchmarks. And so whether it's the Permanency Innovations Initiative we just spoke about, is a really good example of that. Also is the maternal, infant, and early childhood home visiting that was talked about earlier as well through HRSA. What they've done is they've said, yes, we want to look at those early intervention outputs like enrollment. We of course want to look at short-term and long-term outcomes, but we also want to look at implementation constructs. So the government's in a great position to have benchmarks that are mandated for jurisdictions to report on that are related to infrastructure, because there's a logical linkage between infrastructure, fidelity, and outcomes. And if we don't measure the beginning, it's essentially like saying we don't think it matters. So here's a really good example of what that can look like, and the Children's Bureau has done some really nice work around this. If we believe that fidelity assessments matter as part of the infrastructure, in early phases of implementation, milestones could look like ensuring that there's a well enough operationalized program model so that a performance assessment or fidelity assessment can be developed, especially for new innovations or promising practices that don't already have fidelity assessments. So having a fidelity assessment can be an early benchmark. Having data collection and protocol procedures that are set up and written down and documented by a jurisdiction is an early benchmark. Later, as you launch into implementation, as you move into a second or third year, a later benchmark might be that 60% of practitioners are meeting those performance assessments. So it's essentially taking one infrastructure component and looking at what milestones might be related to that over the course of implementation. I'm going to skip this. All right, I'll talk about it another time, but I want to make sure I get through and can really have other folks get a chance. So the first point was need and fit. The second point was measuring and funding infrastructure. And the third point is really around supporting continuous quality improvement. Unfortunately or fortunately, that's become a buzzword, and I always get nervous when things become a buzzword, that not everyone truly understands what's meant by continuous quality improvement. But just as how jurisdictions struggle with doing good needs assessments, they also struggle with good CQI. It's not about collecting the data, it's about using the data. And I think we're really good at collecting the data. It's using it, and I think it was mentioned earlier around technical assistance. And we really have to shore up our technical assistance structures that we put hundreds of millions of dollars into across government agencies to ensure that those TA centers are well positioned to provide TA around the use of data. That is such an important piece for local jurisdictions. There are some really nice frameworks coming out that talk about how it is we optimize evidence. So we think about the idea that evidence is grown in research settings, but it's really optimized in practice. So for any of us that have worked with an array of even evidence-based, manualized evidence-based models, there's adaptations that are made to all of those over time. So I do most of my work in child welfare. Child welfare borrows a lot from children's mental health, substance abuse, and juvenile justice. When those models move into child welfare, in order to optimize that evidence in a new context, it's really important for us to ensure the fact that the intervention is adapted in a way and that the system accommodates in a way for that evidence. And so it really makes me think about David Chambers' article on the Dynamic Sustainability Framework, which was published in Implementation Science this year. David had been at the National Institutes of Health, has since moved to our American Cancer Institute. But he talks in there that interventions can be continually improved, boosting sustainment in practice, and can enable ongoing learning among the interventionists, researchers, the developers of those models, and clients and patients. So really what it does is, for a long time, we've had this idea that we optimize the evidence in the controlled research setting, and then we want to rigidly stick to that when we move it into new contexts. But what we see sometimes is what's called, and David refers to it in his article, as voltage drop, that we don't see the same impacts as we start to scale. So it's not that fidelity doesn't matter, but careful assessment of what's working and not working as we move into new contexts is something that developers are actually getting very good at. And we want to take a look at how that relates to good continuous quality improvement in everything that we run. And so from a policy perspective, that could mean how does we incentivize and support ongoing adaptation and improvement that is data-driven. Not reactionary, not opportunistic like most changes are, but data-driven changes. So there's quite a bit being written on this now in the field of implementation science, and I think it's an important piece for policy